Surgery for big eyes? I hate my prominent eyes. I've been reading about a method called orbital decompression. What is the main cause of my large eyes? I have myopia, -10, and I have very droopy eyes. What method could enhance my appearance?
Thank you for your question. You submitted your question with a photo, and you state you hate your prominent eyes, and you've been reading about a procedure called orbital decompression. And you state that you have -10 myopia. And then finally you ask what could be done to improve the appearance of your eyes. Well, I can certainly share with you my perspective on your question and certainly how I have this type of discussion in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and certainly I have plenty of experience when it comes to orbital decompression, as the most common indication is for a condition called thyroid eye disease or thyroid-related immune orbitopathy. And I think that there's an opportunity here to appreciate some of the perspectives that one can have when looking at your face and at your eyes. What do I mean by that? Well, to begin with, let's start with just understanding how your eyes relate to the eye socket alone. When someone has myopia, -10 myopia, well, that's considered what's called high myopia. And that means that the shape of the eyeball is longer. And when the shape is longer, as opposed to like a smaller egg shape, well, it does have some contribution to the relative prominence of the eye. And sometimes patients who will come in and I'll look at it and I'll ask them about their thyroid, about whether or not they had a history of thyroid eye disease, they'll tell me, no, I don't. Everyone thinks I do. It's either prominent eyes that are a family characteristic, or it happens to also be that they have high myopia and their eyes are a little bit more prominent. Now, that being said, one other perspective to look at is the relative projection of your cheekbone. So if the eye looks relatively prominent relative to the cheekbone, well, then if you just draw a line straight from the cornea downward and the cheekbone is behind, well, we often refer to that as a negative vector, and that comes into play when we discuss lower eyelid blepharoplasty. So what I think is also worthwhile considering is some way to actually enhance the projection of the cheek. Now, of course, as a surgeon, or as many surgeons do, we think of surgical solutions. But we live at a time where we also have a lot of non-surgical options. And so my first thought would be is to not do a procedure like orbital decompression. Although it has been done for patients with high myopia, and certainly it can work, within the concept of orbital decompression, it's typically because you don't have excess volume of fat or muscle thickness, as is the case in thyroid eye disease, you may be looking at what's called a bony decompression. And with that comes a lot of certain significant risks. But when I look at someone like you, and of course having also a facial cosmetic surgery background, I look at the face as a whole and the eyelid and the cheek area. So I actually would think about having you consider something like structural volumizing as a non-surgical approach, and that means using a long-lasting filler that's placed at the bone level. By doing this type of structural volumizing, you can actually enhance. Since you're a younger person, we don't refer to this as restoration, but rather as some degree of an enhancement or augmentation. You can enhance the volume of the cheek as it relates to the eye itself, and you may find yourself benefiting from a little bit more balance. When people, quote, don't like something about their face, very often it's just a subtle amount of shifting of proportion that can create more of what is considered aesthetically pleasing. So I think that it is my style to first try something less invasive before doing something more aggressive. I would also caution you that when you have high myopia, you are at higher risk for retinal detachment. And although there isn't necessarily a cause and effect with having manipulation of the eye or surgical procedure around the eye and retinal detachment, there is always that would be still my concern, because the person with high myopia has has their retina stretched. So relatively speaking, there are areas where it can be particularly thin and at risk of detachment, and that's why people with high myopia see retinal specialists regularly. That being said, I think that when you think of doing something like structural volumizing, an injectable in the cheek area, well, that's leaving your eye alone. So I think it's worth considering, and it's a place where I would suggest starting with before you consider doing other procedure, whether it's a submalar implant or infraorbital rim implant or other things that can also be an option. But I think that we live at a time where we have these really nice injectables that can provide significant time of lasting, such as a Juvederm Voluma, Juvederm Ultra Plus, and at the deeper level can last over a year and even longer. So learn about these options, find and meet cosmetic surgeons who have experience with this area. If you want to learn more about decompression, of course, you'll probably want to meet with an oculofacial, plastic and reconstructive surgeon, and just to try to get a sense of which way you want to go. So I hope that was helpful. I wish you the best of luck. Thank you for your question.